Good evening, everyone. I'm Varsha Shrivastava from Prostate Wellbeing team. I hope you are keeping safe. So, in this week, we are here to discuss about benign prostatic hyperplasia. It is also called as prostate gland enlargement. It is a common condition as men get older. So, in this week, let's unite to raise awareness about the issues related to BPH and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for the diagnosis and treatment of BPH, today we have with us Dr. Vikas Singh sir. It gives me an immense pleasure to introduce Dr. Vikas Singh sir to you all. Sir is a consultant urologist, uro-oncologist, and kidney transplantation surgeon practicing at Choithram Hospital and Research Center, Indore. Sir has a rich experience of more than 7 years in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Sir, it is a pleasure to have you in our show. We welcome you.
Thank you, Varsha. I really appreciate your introduction that you used to introduce me. And we shall start the meeting, I guess.
Yes, sure, sir. So, sir, there are many things that our viewers would like to know about BPH. So, first, let's start with the meaning of prostate. What is prostate?
So the prostate is a gland actually, which is present in man's body since birth. So this is nothing new that develops in body. Like if you compare it with some other glands, like somebody says that I have developed some kind of cancer, it is nothing like that. It is a normal gland which has got a normal function, particular function in our body, which is present since birth in male child. So this is nothing new. It is just the size that grows sometimes when you get older. Nothing new is being born in man's body. It is a normal gland only. It has got its own function that we'll discuss.
Okay. And so, what is benign prostatic hyperplasia?
See, benign prostatic hyperplasia is a complex term. It is difficult to understand for a common person, but everybody knows something about BPH. They have this thing in their mind that BPH is related with urine problem. So benign as word means non-cancerous. Benign.
Okay.
Benign hyperplasia means there is increase in number of cells in the prostate. And benign prostate, you already know what prostate is. So benign prostate hyperplasia. So prostate, when increases in size because of increase in number of cells, and it is not cancerous, it is known as BPH. So that is the meaning of BPH. If you have BPH, if your doctor has told you that you have BPH, there is nothing to worry about. It is not cancerous. First thing and foremost thing is that it is not any cancer.
That's the main part actually, that this is not a cancerous disease. This is something else other than prostate cancer. Okay. So, sir, what could be the early signs or symptoms through which the person can get an understanding that he might be suffering from BPH?
Yes. So when a person who, the male, every man has a prostate gland, but when his prostate glands starts turning into BPH, that is, it has started growing in size and started causing problem, then the most common problems that will occur along with the BPH development is that he will start going to washroom very frequently. He will start having need to get up in the nights to pass urine in between his sleep cycles. He will feel that his flow of urine has decreased quite a lot. He'll feel difficulty in emptying the bladder. He'll feel that I just went to the loo, but still I'm not able to empty my bladder. So these are the common symptoms. Mostly, the old men present with the difficulty in passing urine and going to washroom very frequently. These are the most common symptoms that they present with.
Okay. And sir, what could be the causes behind all these symptoms that are occurring to a person?
So what happens is when you have developed this BPH problem, so you are unable to empty your bladder completely. When your bladder is filled with urine, you get the urge to empty your bladder. You go to washroom and you pass the urine and empty the bladder completely. This is what happens in a normal person. In case of BPH, because bladder gets tired because there is some kind of obstruction which is there in case of BPH formation. So bladder gets tired at half of the way of passing urine. Bladder gets tired and it just relaxes, and you haven't yet completely emptied the urine, and half of the urine remains inside the bladder. So what happens is that if bladder is not completely empty, you effectively have half of the capacity of bladder which is available for next cycle before you go to loop. So if suppose if you have 300 ml of bladder capacity, your effective capacity remains only 150 ml. That is why your frequency becomes just double, because your effective bladder capacity has just shrink to half. So that is the reason why you frequently go to washroom, and also why you feel that you have not emptied your bladder. So that is the reason. That is the main reason why you have this frequency and nocturia, which is getting up in the nights in between to empty the bladder, and difficulty in emptying the bladder. So this is the reason, because you increase the you are not able to empty the bladder completely, and there is always some amount of urine remaining in the bladder all the time.
Okay. So these can be the different causes behind the occurrence of BPH. Okay. So, sir, whenever the patient or the person is getting such kind of a symptoms and he goes to the hospital, so what are the different tests which are conducted to get the surety that the patient is suffering from BPH?
Good question. So if you feel that you have any of these symptoms where you believe that there might be a chance of prostatic involvement, first of all, you have to involve a qualified urologist in your treatment. You go to some hospital or nearby clinic of some urologist who's qualified to treat this disease. Talk to him, tell him about all those symptoms that you are facing. They will decide that this this condition of that person requires or merits some investigation, some tests, which are readily available in almost all of the laboratories. So there are fairly simple tests. One is sonography that you need to do, that will check your kidney, ureter, bladder, and the remaining amount of urine that remains inside the bladder after you pass urine, which is known as post-void residual urine, PVR, that I just talked about, that remaining urine. And one is prostatic health checkup, serum marker known as PSA. So PSA test needs to be done, urine needs to be checked, and one more test which is commonly done, and I always ask my BPH patients to undergo, is uroflowmetry. When where the patient is asked to pass urine in a controlled environment over some machine, so his flow gets analyzed. So after analysis of the flow curve, mathematical analysis of the flow curve gives us very fair idea whether the person is having BPH or not. So these four tests, nothing very complex. Sonography, one blood test of PSA, urine test, routine test that you can give anytime. There is no need to collect urine in the morning hours. Whenever you are free, whenever you are visiting the hospital, you just give the sample. And the last one is the uroflowmetry. These four tests will make us very close to the diagnosis of BPH.
Okay. Okay, sir. So, sir, once these tests are conducted and the patient now has got the surety that he is suffering from BPH, so now what are the possible treatment options available to treat BPH?
Yes. So when it is diagnosed that the person is having BPH and he requires some kind of treatment, then we have plethora of options which are available. See, first of all, you have to decide whether the person needs some kind of treatment or not, because in the initial days of their BPH development, men between 40 to 60, sometimes they get benefited by lifestyle modifications also. So there are many lifestyle modifications that you can use to decrease the symptoms. You cannot stop the process of BPH development, but definitely for some years you can decrease the symptoms by the way you conduct your lifestyle, the way the amount of food that you take, the amount of uh, caffeine and tea that you take. So all these things contribute to the symptoms and increase the frequency of urination. So those things definitely come into the picture. But once you have decided that the person requires some kind of treatment, there are 3, 4 treatment options which are available. One is medical treatment option. Second one is surgical treatment option through the open surgery. Third is surgical treatment options with the endoscopic surgery or laser surgery. And fourth option remains the robotic surgery option. So all these four options are there. So most of the patients fall either in two categories. First one is medical treatment, where some drugs are given to the patients. Most of the drugs require only single dose per day. So you take that capsule or tablet once a day, and that's all. Your most of the symptoms will disappear, and the person will be happy for at least quite a long time, maybe some years. And the second most common option is, if these non-medical options are not working for some person and the condition is deteriorating, then we can go for the laser or TURP surgery, which is a very common surgery frequently performed by all the qualified urologists. So that is the second most common option, which is being preferred by the patient. Third option of open surgery is rarely done these days. This is the era of minimal access surgery, where patient's body is disturbed very least for the treatment. And the fourth option, which is robotic surgery, is required only in case of very large gland, where the endoscopic options remains very suboptimal, like 200, 300 grams, where the prostate has increased in the size like 10 times, 20 times, then we may require robotic surgery. So that is also a very rare condition. Mostly patients get benefited by medical therapy, once daily dosing of some capsule or tablet. And the second option is laser treatment or TURP treatment.
Okay, sir. So, after the surgery is done, what are the possible things that the patient need to keep in his mind so he is not facing any kind of difficulty in future?
See, a good surgery is always welcome. I mean, nobody wants to undergo some kind of complication in the post-operative period, but definitely there are 2 to 3% chances of some kind of problem that remains there to be seen, to be diagnosed, and to be treated. But most of the patients, like 97 to 98% of the patients, get benefited by the this most common surgery, which is known as T.U.R.P or laser surgery. So most of the patients do get benefited by this surgery. So this surgery is done in finished in 1 hour, and patient is mostly discharged on next day or very next day. And the catheter is removed on the second day, just before the discharge. And there will be a little bit of burning sensation in the urination after the surgery for like 2 3 weeks, and after that, that will also wean off. And after the surgery, there is nothing much for the patient to be done actually, to do actually. It is just a normal routine. So one thing that I always ask my patients to do is pelvic floor exercise, which I always teach my patients how to do. So that helps in early recovery. So that is one thing I ask my patients to do. And the other common advice is like decreasing the intake of tea and coffee, coke, and spicy food. That also helps in reducing the symptoms after the surgery. So these are 3 4 advices that I give to the patients. Mostly patients do not require any follow-up surgery, and um, any surgery after even a very long time also. If you have done a good surgery, you do not require any follow-up surgery. That is the crux of the matter.
Okay. And sir, what happens if the patient is not taking the treatment for BPH? What can be the consequences that he has to face?
Yeah, well, this question is very important, because many a times what happens is, you see the patient in the OPD, you describe them the problem, what they are facing, you tell them the importance of the problem, but they still don't believe that, because they may not be having the exact symptoms of the problems that are going inside their body. So they believe that, okay, I'm fine. What is the need to undergo this surgery? So you have to understand the urine that remains in the bladder, and the part of the urine that you are not able to empty, that can go into the kidney, and then it can cause a lot of problems in the kidney. I have seen patients whose kidneys get failed because of this problem. So that is one problem. That is one very big problem that a person can land into. The other problems are, if the BPH problem is not solved, the bladder gets so much compromised that even if you operate in the later stage, the results are not good. I mean, the patient will not be happy, patient will not be satisfied, because the bladder has got completely damaged because of this problem in a long term basis. So even if you treat the patient, those results which are expected by the patients will not be achieved. So these are the two most common problems. If you do not undergo timely surgery, these are the problems that can occur. The bladder gets permanently damaged, and the kidneys also can get damaged if this thing is not this problem remains unchecked and is not treated in time.
Okay. Okay. And so, what are the food items that the patient need to include in his diet? Does it really help in treating BPH?
See, there have been many trials, many literatures, many medicinal teams have tried so many plant extracts, so many vegetables. Some people say that tomatoes have got lycopene. Some people have come up with the studies also that lycopenes prevent BPH formation. There are theories that regular sexual intercourse, even after 40, 50 years, can prevent BPH formation, but these theories have proven to be not very authentic and they're actually rather, I would call them unproven. So there aren't many drugs that can, there aren't many there's food items that can prevent BPH formation, but definitely as far as the health of the prostate is concerned, pelvic floor exercise, also known as Kegel's exercise, that do help in case of BPH symptoms. Second thing is that you decrease the irritants in your food habit, like caffeine, tea, coke products, and spicy food, oily food. These are the irritants for the bladder mucosa that increase the symptoms. So if you want to get lesser symptoms for a larger disease, then these items should be avoided. Uh, I won't say that at any cost, but you should moderate the use of these items in your food bills. That's all.
Okay.
Nothing much to be done from the food side. There is nothing much you can do. It grows because of internal hormones. Unless you stop that hormone in your body, so the prostate will keep on increasing in size, and that hormone is very important for the men's health, so we can't stop that hormone also. So
Okay.
that is it.
Okay. So, sir, in the end, what is the suggestion that you would like to give to our viewers who are listening to you so carefully and trying to understand about benign prostatic hyperplasia?
So to all my viewers, uh, remember one thing: if you are above 50 and you have this problem of getting up in the night for more than 2 times, I will give you 1 time extra. Actually, literature says that more than 1 times is not normal. But if you have to get up in the night more than 2 times, you feel that you are not able to empty your bladder. You feel that there is some problem going on in your urinary system. Search for a nearest urologist who's qualified, MCH or DNB, who are able to treat this problem. Go talk to them, consult them. You may be at the very early stage of your benign prostatic hyperplasia disease. So in that situation, you may even not require any kind of treatment. Don't run away from the treatment, because that is the one thing that can lead to a bigger problem, where you
Yes.
can land up in some large problems, some bigger problems where even doctor won't be able to help you out. So catch this problem at the earliest. Talk to the doctor, meet him, take his advice, take all those lifestyle modifications, bring those modifications into your life, and you probably will be able to manage it nicely, and you won't face many complications or problems because of this problem.
Surely. So, sir, indeed, it was a very, very informative session for all our viewers. They got to know many things about benign prostatic hyperplasia, the meaning of it, causes, symptoms, the possible treatment options, and of course, if we will leave it untreated, then what are the complications that the patient might have to face. So, it was very much informative, sir. Thank you so much for your precious time once again.
Thank you, Varsha, and thank you, IPCA team, for inviting me for this webinar, and very nicely conducted by the prostate wellbeing team. And thank you all. Thank you for joining.
Thank you so much, sir, once again. And thank you to all our live viewers for being so patient and listening and noting down all the important points over here that we have discussed about BPH. We'll see you all soon in the next session. Till then, you can follow us on our FB page. You'll find us by the name of Prostate Wellbeing. You can also follow us on YouTube, Twitter, and Instagram by the same name. This is your host, Varsha Srivastava, signing off. Thank you so much, sir, once again.
Thank you. Thank you so much. Start the video. Thank you, Varsha. Thank you so much.
Thank you, sir.